Well, again, thank you so much for taking the time to sit down with us. It has been an eventful, to say the least, 4 years for you that has come with successes and also challenges, plenty of challenges. With 10 days left in office, have you, at this point, had an opportunity to just kind of sit and reflect on everything that has happened in your time in office?
Well, I have some, Brittany, but it's been very busy. Every day there's something happening in the Commonwealth of Virginia, and so the job as governor is just to oversee all of our agencies, our cabinet secretaries, and really to keep Virginians safe and healthy. And so, dealing with COVID for the last 2 years, and I just got off a call a little while ago looking at our numbers, looking at the data, and how many people are in our hospitals, how many people are in the ICUs, and then obviously we had the winter storm that came through on Monday and caused havoc up on I-95. So there's always something going on, but it's been a real privilege, serving as governor. And then prior to that, I was lieutenant governor for 4 years, and then served in the Virginia Senate for 6 years. So it'd be a total of 14 years. It's been an interesting journey, but quite a privilege. I've learned a lot. I'm a better person, and I certainly hope Virginia's a better Commonwealth as a result of a lot of the work that we've been able to do.
As a young man from the Eastern Shore, did you ever imagine that you'd be sitting here as governor, that you would serve the Commonwealth of Virginia?
I grew up on a small farm outside of a town called Onancock on the bay side of the Eastern Shore. I worked on the water, worked on a farm, and that was farthest from any of my dreams or ambitions was to even go into politics. And I went into the Senate in 2008 because I was worried about the demise of the Chesapeake Bay, and also I had some concerns with the direction of health care. And even at that time, I didn't have any desire to be governor, but your life takes interesting twists and turns, and I served for 6 years in the Senate and then 4 years as lieutenant governor, and became very passionate about some of the things that we've been working on, like access to health care and early childhood education, and that led me to run for governor, and here I am. My term is almost finished, and I look forward to getting back into my private practice and coming full circle. I was trained as a child neurologist. I enjoy seeing children and their families, and also teaching, and I think I'll bring a different perspective to that as I move back into the private sector in a couple weeks.
You were elected in 2017, took office in 2018, and then about a year into serving, you were faced with what at that time was the biggest crisis of your administration, and that was the blackface KKK picture. You initially apologized, and then you said that it was not you in the picture, and ultimately the investigation was inconclusive as to who was in the picture. But through all of that, there were Democrats and Republicans who were asking for you to resign. Considering that this was very early in your administration and the potential for distraction that this could have been going forward, why did you not step down?
Yeah, well, that was a very difficult time for Virginia, and I'm just glad that Virginians stuck with me. I committed to myself and also our cabinet to listening. I traveled around the state and listened to a lot of people. I read a lot. I watched documentaries, and I learned a lot. And I always tell people the more we know, the more we can do, and what we learned, we really were able to turn into action, and especially in the areas of racial justice, criminal justice reform. We raised the felony larceny threshold. We ended the death penalty in Virginia. We legalized the recreational use of marijuana. And, we had known, and I certainly knew from my past history, that there were a lot of inequities that existed in this time frame, and we had worked on some of those, but the yearbook incident really put that into more focus, and from what we learned, we were able to, I think, do a lot more. And I know I'm a better person because of it, and I think the Commonwealth is as well. And while our economy has done well in Virginia. That's very important. The most important thing to me is that Virginia has become a more inclusive state. We embrace diversity. And as I like to tell people, it's really the diversity of Virginia that makes us who we are, and we're becoming more diverse every day. So the fact that Virginia is now an inclusive and welcoming state, I think we're in a better place. And when we talk to businesses, and I literally have traveled around the world recruiting businesses to come to Virginia, it is very important that we recognize diversity, that we embrace that we're welcoming, because businesses, if we don't do that in Virginia, they'll go elsewhere. So what we've really proven is that we can be a progressive state, and we can also have a strong economy. And I think people will look back at these last 4 years and say that we were able to learn and do some really good things for Virginia.
You said that incident made you a better person.
Yes.
In what way?
Well, I have a saying, Brittny, and I use this when I teach medical students and residents, that the eyes can't see what the brain doesn't know. And there was a lot going on around me that I thought I knew about, but I didn't. And so to listen to people's stories, to listen to the inequities, to see what happened in Minneapolis to George Floyd, I mean, that opened my eyes, and I think it opened a lot of other people's eyes, especially those that look like me. And so when you know that that's going on around you, if you're in a position like I am as governor where you can make changes, then it's a great opportunity to make Virginia better. And as I said, it's also made me a better person as well.
If we fast forward to December of 2019, that is when reports started coming out of China of an illness that doctors couldn't identify, and they weren't sure what it was. As a doctor, when you started to see those reports, did that raise alarms for you?
It did, and you know, I was in the Army for a total of 11 years, 8 years active duty, and so I was trained in chemical and biological warfare and other types of warfare as well. I had never experienced a biological war, but that's essentially, you know, what we've been fighting. It's not us versus them, it's us versus a virus that, by the way, we can't see, but we know it's out there, and today as we speak, it's out there, it's alive and well in just a new variant called Omicron. But what this did, you know, I think to be a doctor and to understand the importance of data, the importance of science, and to use that and use my background to really do everything that we could to keep Virginians safe and healthy. So, you know, maybe someone was looking down on us and said maybe this is a good time for a doctor to be governor. But it's been a difficult 2 years, and it's the analogy I'd use is, as a doctor, it's like being on call every day. But I signed up for this, so that's all good. But I do want to commend and compliment our staff. We have over 100,000 state employees, and my cabinet secretaries, especially my Secretary of Health, the Health Commissioner. I mean, we have literally worked every day, weekends. There have been a lot of press conferences, and we've done this to keep Virginians safe. And I think if we look at Virginia compared to other states, our numbers are a lot lower. And hopefully, I just had a discussion this morning with some of my team, you know, by doing this, I think we've saved a lot of lives in Virginia, especially compared to other states. So I'm very proud of the work that our staff and the work that Virginians have done. And for the most part, Virginians have followed the guidelines. And again, we've still got some work to do. I'd like to see more people roll up their sleeve and get a vaccine and make sure they get the booster. But we're in a lot better place than we were 2 years ago.
And it has been a long 2 years. So looking at that, so first, let's look at what do you feel you and your administration and Virginia have done well when it comes to the pandemic?
Well, just to go back to our first case was on March the 7th of 2020. It was up at Fort Belvoir. And at that time, Brittny, we didn't have enough PPE. Governors were literally competing for the PPE, the personal protective equipment. We were ordering supplies from other countries, especially Asia, didn't know what we were going to get, if we were going to get it. And with governors competing, with healthcare systems competing, we finally were able to get this supply of PPE we needed. And then we got into the testing. And I think everybody remembers that initially it was hard. We didn't have the reagents, we didn't have the nasal swabs we need, but we finally got that up and running. And then the vaccine rollout. And initially that we didn't have the supply that we needed, and people were waiting in lines. And now we have 3 safe and effective vaccines, and over 80% of adults have now had at least 1 shot. I think the numbers this morning, I saw 67% of the total population in Virginia is totally vaccinated. So, so we've made a lot of progress, and it's been frustrating along the way, because every day there have been challenges. But again, we've stuck with it and worked hard and done everything that we can to make sure that Virginians are safe.
On the flip side, it's very easy to Monday morning quarterback at this point, but is there anything that you wish you had done differently with the pandemic, or anything that you feel the Commonwealth could have done better?
The toughest decision, I think, along the way was when we closed schools. And looking back on that, Brittny, our children, I'm a pediatrician, so I can speak from some experience, but our children need the socialization. They need to be in the classroom. And so it was very difficult for our children. They sacrificed, as did their families. Families had to be at home with virtual learning and all the challenges that came with that. And as soon as we could, and as soon as we could do it safely, we had our children back in schools. But at the time, it was the right thing to do, because there were so many unknowns about the virus, and we were trying to keep people safe and healthy. But children have paid the price for that. And so certainly as a child neurologist, one of the things I look forward to getting back into my practice, there are a lot of children out there with mental health needs right now, and hopefully whether I can help them personally or help other providers make sure that we give them the care they need. That's what I want to do moving forward. But that was a tough decision. Would I have done it again? I would have, because there were so many unknowns, but it's been hard on our families.
Going forward, when we look at the Commonwealth and the pandemic and what you think could be to come, knowing that there is an incoming administration that has indicated that they may make some changes when it comes to the approach to COVID-19, what do you see going forward for the Commonwealth when it comes to continuing to fight this pandemic?
Well, just to put my doctor's hat on, as long as this virus continues to exist, it will continue to mutate, and we'll have new variants. And we had the Delta, and now we have Omicron, and there may be another or more after this. So we need to be vigilant, and we need to stay on top of this and really not let our guard down. People need to continue to get vaccinated. I mean, there's still, especially in rural areas, people that have chosen not to be vaccinated. And I look at the death rates every day. I look at the number of individuals that are in our ICUs. These are all avoidable. And the way to do it is to roll up one sleeve and take a shot. So the school situation right now, it's in the code of Virginia that we follow the CDC guidelines. Well, one of those guidelines is that children need to wear masks. And so I hope that will continue. And so it's kind of the basics of COVID-19. I will say, get vaccinated, keep your distance, wear a mask, wash your hands, and don't, get into large crowds. If we can continue to follow those guidelines, then I think we can keep it under control. But until we vaccinate the entire world, it's not just about Virginia, not just about this country, but it's the entire world, and suppress the virus enough where it can't continue to replicate, then the virus is going to continue.
It's so timely that you're talking about masks in schools, because we do have a district in our area that has put it out there that if the rules change when it comes to COVID, that masks will be optional in schools. So.
Well, that's going to be a problem, and I'll tell you why. Because teachers and the staff, they don't want to get sick. There are a lot of families that don't want their children sick. And Brittany, I and my wife, by the way, who's done so much great work with early childhood education, we visited so many schools. The children, they don't mind wearing a mask. It's the families. And so people need to get over that and really do what's in the best interest of keeping everybody safe. And we know to be safer and stop the spread that having a mask over our nose and mouth helps. You know, I'll use the analogy, Brittany. I work in the operating room a lot. I don't think a patient would feel real comfortable if we walked in our street clothes and no mask over our face. And those are there for a purpose. And that's the same reason to wear a mask because of COVID until we get this under control. So I hope that mask mandates will continue in schools. And we've encouraged, you know, when you're indoors and around large groups to wear a mask as well. And so that should continue to make sure that the vaccine is accessible, especially in an equitable manner. And one of the things we've done is taking the vaccines to the people. We've got mobile units, and so hopefully that will all continue to make sure that everybody has access to the safety.
You are a graduate of VMI, which is also a part of our coverage area. So we covered very closely the reports of sexual misconduct on campus, racism, sexism. As a VMI grad, when you initially heard those reports, what were your thoughts? Because you know the culture, you were there at one point.
Well, they're very disturbing, and they were also very disturbing to a lot of other legislators, our Attorney General, our Lieutenant Governor, and changes needed to be made. And so we did the investigation. We found that there were legitimate concerns with sexism, with racism there, and recommendations were made. There's a new superintendent, General Wins. He's done a phenomenal job. I made some changes to the Board of Visitors. We made it more diverse. And VMI is in a better place because of that. There are a lot of folks that didn't agree. When I say a lot of folks, a lot of alumni that didn't agree with the changes that were made, but they were necessary. And I will remind folks, Brittany, VMI is a state-supported school. And just like back in the 90s, when a number of individuals fought against women coming to VMI, women have just as much a right to go to VMI as men do. And they spent years and a lot of money fighting that. And the same thing was going to happen at VMI if we didn't make changes. So VMI needed to get rid of the statues. They needed to get rid of the names on buildings that honor Confederate generals. People didn't need to be walking outside of barracks, especially people of color, or anybody for that fact, saluting men that had fought for the institution of slavery. So VMI needed to open its doors, be more welcoming, have a more diverse faculty, a more diverse staff, and a more diverse corps. And I have been back. I went back a couple weeks ago. I addressed the corps, and I'm very pleased with the direction that VMI is taking.
Looking back at your time as governor, what do you want your legacy to be?
You know what, Brittany, I'm not about legacies. What drives me each day is to really help people. You know, I served in the Army. I was the medical director of a pediatric hospice. I took care of terminally ill children on a volunteer basis for close to 20 years. I've probably seen over 100,000 children and their families in my practice over the years. And so I like to help people. And so that's what I've really tried to do as governor. I think at a different level. I mean, certainly to expand Medicaid. Now over 550,000 Virginians have access to health care that didn't before. And certainly during this COVID, pandemic, I mean, I can't imagine people not being able to go see a provider. So that was a big deal. You know, being able to repeal the death penalty, that was a powerful experience when I went to the Greensville Correctional Institute. And then I think probably most importantly, I like to remind people, if we talk to someone on the street and say, what is the most important thing to you? It's having a job. that they can support themselves and their families no matter who they are, no matter where they are in Virginia. So I have worked very hard to really drive our economy. We've got a very talented workforce. Businesses want to come to Virginia. And so for Virginia to be the best state in the country for business, not once, not twice, but 3 years running. I'm very proud of that, and that didn't happen in a vacuum. And so, I really think the next administration, they have a great opportunity to build on a lot of the progress that we've made, and also a responsibility as well, because what we've done has been in response to listening to Virginians and then put that into action. So that's a long-winded answer to your question, but I think at the end of the day, when someone looks back at this administration, they can say this was one of the most progressive administrations that Virginia has ever seen, and at the same time has the strongest economy that Virginia's ever seen. To leave a surplus of $2.6 billion to the next administration, that's a record. To be #1 in the country for business, to have over 100,000 new jobs in Virginia. So we're very progressive. We embrace diversity. We take care of our workers, and at the same time, we have a very strong economy. That's what people will look back and I think remember this administration for.
What perhaps, so if you had to pick, you got to pick one thing that you are proudest of that you all have accomplished, just one. What would that be? Well,
you know what, Brittany, I'm proud of a lot of things, but
you just listed many things.
But I'm going to answer your question, and this comes from being a doctor and having seen sick children and sick people, and that's when sometimes we're at our most vulnerable state, when we don't feel well and we need to see a provider, a doctor. So to be able to expand Medicaid, I was a big fan, I am a big fan of President Barack Obama, the Affordable Care Act. When he came into office, Brittany, he promised that everybody in this country would have access to affordable and quality health care. And every time he'd take a step forward, they tried to knock him back. But he was able to get the Affordable Care Act passed. And part of that was for states to opt into Medicaid expansion. And finally, after a number of years, we were able to do that. I did it in a bipartisan way. And so I think Virginia, because of that, is healthier.
I'm sure you're probably ready for a little break from office, but would you consider running again?
I won't ever say never, but this has been the privilege of my life to be a public servant and to serve in the Senate, then lieutenant governor, and now governor for the last 4 years. But I really look forward to going back to my practice. I'm trained as a physician. I enjoy seeing kids. I enjoy teaching. I think I can bring a really better and different perspective to taking care of patients and also to teaching. So I look forward to going back to my practice. Inauguration is on the 15th. I'm going to take the 16th off, and then I've already got patients scheduled for the 17th. So I'm looking forward to that, but I don't think you'll see my name on a ballot anytime soon.
Okay. It seems like you'd at least take a week or two off. But
well, that's what my wife wants me to do, but I'm ready to go.
Okay. All right. Well, finally, what final words of wisdom or words of advice, or what final words do you have for the people of the Commonwealth?
Well, I think that, I'm biased, but I believe we live in the best state and the best country in the world. And as I said earlier, I've really tried to put a lot of focus on our economy, but I've also put a lot of focus on embracing diversity and Virginia being an inclusive and welcoming state. And so I hope that will continue. And I really, as a doctor and just as a parent and as a husband, I hope that we'll continue to look out for each other. Every day there are challenges, and we're all in this together. And one of the things that, I'm so proud of, and Pam, my wife, has done so much work on is the early childhood education. And that's important for a lot of reasons. I mean, we think about the didactics, learning the numbers and the letters, but I think the most important thing is that we're all God's people, and there's a lot of hatred and bigotry in our world right now. And you know, I've taken care of a lot of babies and toddlers, and that's learned behavior. You don't see hatred and bigotry in little babies and little toddlers. And so I think if we can really, you know, get to them at an early age and make sure that we let them understand that we're all in this together, that we're all God's people, and in that case, God's children, then we'll have a better world. And so that's what I would ask people to do, is to keep that in mind and take care of each other.
All right. Anything else you want to add?
You know, there are a couple things I would just mention. We didn't talk about the renewable energy, and I've put a lot of emphasis on that. And again, a lot of that comes from feedback from businesses and companies that are growing in Virginia and also that want to come to Virginia, but they're very interested in our focus on renewable energy. And we have a plan by 2045 to be entirely, you know, carbon neutral. And so we've got a lot of solar projects across Virginia, and we've also put a lot of emphasis and energy into offshore wind. And I know that doesn't affect Roanoke and Lynchburg area as directly, but that's a real game changer. It's going to transform Hampton Roads, and not only are we going to, you know, have offshore turbines, about 200 of them off Virginia's coast, but North Carolina, Maryland, New Jersey, and on up into New England. And so we're going to service those right from Virginia, not only to put them together, but to also manufacture them. And so this will provide thousands of well-paid jobs in Hampton Roads. And so it's great for the environment. Global warming is real. Sea level rise is real. We need to address that. So it's good for the environment, but it's also good for the economy. It's going to provide a lot of jobs. So that's been something we've put a lot of emphasis on.
I got a quick question.
Sure.
What is your biggest piece of advice for the incoming administration?
Wow. You know, I've thought about this a lot. I think that's a good question, and I think as the governor, if someone asked me for advice, and I've had a couple good meetings with Governor-elect Youngkin, I'll be glad to share. But I'm not going to, you know, voluntarily solicit it. But as far as Roanoke and the Southwest, I think that to continue the work we've done with broadband. You know, when I came into office, Virginia was investing about $4 million a year, which was totally inadequate. And there were a lot of families and a lot of businesses, especially in rural Virginia, that didn't have access to broadband. This year, we're putting a total of over $2 billion. So contrast $2 billion with $4 million. We're 90% toward taking care of making sure that everybody has access to broadband. So that needs to continue. In 2021, it's a necessity. It's like electrification was back in the early 1900s. Transportation is really important for the Southwest. We put a lot of emphasis on 81, 58 at Lover's Leap there in Patrick County, but bringing rail to Roanoke and then out to the Southwest. As you know, we've made announcements to go into Christiansburg, Blacksburg area, and then hopefully to Bristol. So that's going to be a big deal. But, you know, I guess if I had to give anybody in this job advice, it would be to listen and just to go around with your eyes open and know that there are always going to be people in need of your help, and to put the politics aside. You hear me talk a lot about the Virginia way, that, you know, we can agree to disagree, but at the end of the day, we need to do what's in the best interest of Virginia. And so to have empathy and to be a listener, and then to get up in the morning and say, how can we help these individuals? You know, I think that's the most important part of being governor.
Carter, that was a phenomenal question. That's it. Anything?
No, I think you've covered everything I